Welcome to part 2, the very special edition of Harford MagaScene about the impact of COVID-19 pandemic on Harford County. As you know, life changed drastically for all of us in mid-March when Governor Hogan announced actions to help prevent the spread of the virus. From closing schools, malls, movie theaters, most people now working from home, and travel only for essential reasons only. This has been the most challenging time in most of our lifetimes. Now we have all of our guests joining us today. They're going to be answering questions remotely to comply with the social distancing measures. Hear what they have to say in the next 30 minutes. I'm Kristy Breslin, and this is Harford MagaScene. Well, I'm now joined with Dr. Fahim Yunus. He is from the University of Maryland Medical Center, Upper Chesapeake. He is the chief of quality there. He is here to talk to us about COVID-19. Where did it come from? What are the symptoms? And what can we do to prevent the spread? Doctor, thank you so much for being with us today.
Thank you so much for having me.
Now, Dr. Yunus, what exactly is COVID-19?
So, this is a novel, a brand new coronavirus, which no one had any immunity to it. It's a respiratory virus that causes infection of the upper and lower respiratory tracts. And now we know that it actually impacts other parts of the body as well. Typical symptoms are fever, coughs, shortness of breath, chest pain, and severe body aches. But what makes it a little bit more scary is that up to 20% of the patients, at least in the early phase, may not have any symptoms and still be contagious. So that is why all the precautions that we require are necessary.
Now, doctor, are there two different strains of the virus? If so, does that mean we could actually get it again?
So I believe that there will be many strains of the virus. Every time the virus infects a new person, it's a clumsy virus. There is some mutations that happen. However, those mutations are not clinically significant, meaning it does not change the mode of transmission of the virus or the way we treat it. It's just like the dandelions in the backyard. They all may be a little bit different, but they're still dandelions. So I don't think people should be afraid of different strains. As far as immunity, it's a great question. It's a new virus. We don't know for sure, but my 20 years of experience in working with viral illnesses tells me that once you get a viral illness and you fully recover from it, then you will have some immunity. Whether that immunity lasts you 3 months or 3 years or 30 years is debatable. But I think, yes, there will be some.
Now, at first, we thought it was just the older generation that was getting the virus. We thought they were the ones more susceptible to it. But now we're hearing people in their 20s, their 30s, their 40s. We're even hearing about children getting the virus. So, who is susceptible to it? Is it all of us?
That's a great question. So I think everybody's vulnerable. Nobody's immune to it. But what we are seeing in the world, as well as in Harford County so far, that folks over the age of 60, those who are immunocompromised, those who may have cancer, who are chemotherapy, hemodialysis, or biological agents or steroids, those are the folks who have a higher risk of getting to a hospital or even dying. So anyone can catch the infection. The outcomes we still believe are worse in the elderly and immunocompromised. But no one is immune. No one should think that I can just go out and party and I'm immune to this virus.
We've been hearing a lot of different theories about how the virus came about. What is the exact origin of COVID-19? Where exactly did it come from?
We believe so far that this coronaviruses are endemic among animals, and this particular virus most likely originated in a bat, then went into a pangolin, and then jumped into humans. This happens all the time. There is a tendency for these viruses to percolate among the animal kingdom, and every 10 years or so, one of these viruses hits a lottery and jumps into the human kingdom. At the same time, I am aware if you're thinking that some people believe it's a man-made, lab-made virus, so far the evidence scientifically is not proving that. The good paper in Nature, one of the leading journals in medicine, actually had authors from Australia and Europe and US, and they all looked at the virus. And then, to put it in layman's term, there can be some fingerprints when you manipulate a virus, and none of those fingerprints were seen. So I don't think currently there is any data to suggest that it's man-made or lab-made.
Doctor, what should we do if we suspect we have it? Because right now, I guess going to an urgent care or even the hospital is kind of out of the question.
It depends. I think there are multiple parts to this answer, and let me take them one by one. Most healthy people will get better. About 80% of the people will never need a hospitalization. Once testing becomes more adequate, you can always call your doctor. I don't advise anyone to go into a doctor's office or a nursing or a ER. We're trying to practice social distancing and protect our front lines. But through telemedicine, you could get an order and you could get a test done out in the community. Upper Chesapeake Health is providing one such service as well, where we have this mobile sample collection. That's one aspect of it. At the same time, I don't want people to be afraid of hospitals. Now, I'm not talking COVID, I'm talking regular heart disease, wounds due to diabetes, stroke, GI bleed, COPD. Hospitals are safe places. We are practicing the best personal protective equipment and policies that there are out there. My worry and the worry among my physician colleagues is we don't want patients to neglect their health because of a fear of hospitals. We don't want to see diabetic foot wounds turn so bad that people have to lose their limbs. We don't want people delaying their care for chest pain. So I think it's a big composite. For COVID, yes, there are ways to get tested, even without leaving your car. You can drive to that sample collection, get the test ordered by your physician, and we are here to help you. I think this is the time for all us to be together. We want our community to remember that Upper Chesapeake Health was there for them when this thing happened, because we're going to get through this one day.
I sure hope so. Now, speaking of getting through it, a vaccine. Is there a vaccine in the works? And if there is one in the works, how long till we would be able to actually get it into our community?
Sure. So there are more than 40 vaccine candidates that are being researched and tried right now. I think I've never in my career seen this sort of scientific collaboration globally and this sort of a rapid response. I know this may be too slow for some people. The reality is you have to understand that a drug or a vaccine typically takes 5 to 10 years to develop. That's how long those pipelines are. Just think of it like undergrad. A typical undergrad college will take 4 years. If you're the absolute brilliant student with tons of AP credits, you may do it in 2 years, but there is no way to do it in 6 months. So there are certain realities you have to face. And I think for vaccine development, if we get a vaccine, my hunch is in a year or 18 months, we will have more than one vaccines, perhaps some from China, some from Europe, some from US. And that's the kind of collaboration we need at this stage. The virus is united against mankind. We have to be united against this virus if we have to win this pandemic.
Absolutely. And let's talk about the impact because it's having a major impact on Harford County hospitals and frontline employees. So elaborate a little bit on that.
While I walk through the hallways of Upper Chesapeake Health, I truly feel like I'm walking through a bunch of soldiers. So talk of being purpose driven. I think the front line is, and when I talk about it, I'm not saying this doctors or nurses. I'm talking about people who are cleaning these hallways, people, the techs who are taking care of these patients, the food and nutrition, the security, anyone, and even beyond the walls of the hospital. So yes, there is a lot of stress, understandably so. All human beings feel anxious when you don't know about the future. But the beauty is that this team is razor sharp, focused on providing the best care to all patients every day, whether they have COVID or non COVID. Along with that come certain pressures. I think we are trained professionals. We can't complain. Our job is to meet you on the other end of this pandemic curve.
Well, we are lucky to have someone of your caliber talking with us today, and we're lucky to have a hospital such as University of Maryland Upper Chesapeake right in our backyard. Now, from your medical perspective, how long do you think it's actually going to take for these numbers to decline and when we could see, maybe some kind of normalcy?
So once again, I think nobody knows. The places with high population density, of course, are going to have different outcomes as compared to places with low population density. Even currently, if you look at the map of Maryland, places like PG County or Baltimore County, Baltimore City, and Arundel County, they have much more cases. So I think this may take months, this may take a year. It's not about the date, it's about the data, because we don't get to control how the virus behaves. We do get to control the data and the social distancing policies, where Maryland was one of the first states to institute those policies. So I think what people should know, that they are blessed to be living in a state where there is absolute top to bottom unity, from our governor to our political machine to our Upper Chesapeake hospital to our University of Maryland 13 hospital system to other hospitals. So I think this is the beauty, that we're unified in our response. I can't predict the date, but I'm pretty hopeful that we will hit the best possible date because of that top to bottom alignment in our response.
Dr. Eunice, let me ask you, if you wouldn't mind, could you give our viewers some words of encouragement and maybe give us an idea of the best precautions that we can take for ourselves and being around others to avoid being infected with COVID-19?
So precautions first, and some advice after that. I think as far as precautions are concerned, again, as a state, we're doing a wonderful job. You could Google all of that. Wear a mask when you go outside, follow all the government orders, maintain 6 feet social distancing wherever possible, wash your hands, get good sleep. Because one thing you can do to prepare for this virus, God forbid, if it comes at you, that your immune system is going to have to fight it. All the medications are currently experimental. We don't want you to get so far along where you need a ventilator. How about we prevent that? Eat well, do good exercise, get some digital disconnect. Have some time in your day where you are disconnected from your devices and really energizing your soul. Now, as far as what can we do, what is the advice? Just look at the trees outside your house. They're beginning to bloom now. They went through a harsh winter. They do it every year. They lose all their leaves. They survive in sub zero temperatures sometimes, but they don't die. After every season, they come back and bloom again. They do it every year. We have to do it once in our lifetime right now. At least I had to do it once in my lifetime. I think the lesson from the trees is a profound one. This is a harsh winter for us. It's not easy, it's difficult, but we will come back again. Our economic losses are like those leaves. I understand there is an economic price we're paying, but let's be generous to each other. And that money will come back. Those leaves will sprout and bloom again. But let's not be hopeless.
Dr. Eunice, I can't thank you enough. Great advice. I really appreciate you taking the time out of your busy schedule. You're speaking with us on a Sunday. Very grateful on my end, and thank you for the words of encouragement. They're much needed.
Thank you very much. And I just want our folks to remember, we are going to get through this. And University of Maryland Upper Chesapeake Health is here for you today. And we will want to be remembered that we were there for you at the time of need. We're all one. This virus is a great equalizer, and we are going to cross this curve together.
Dr. Eunice, thank you so much for being with us. Your words of advice are very encouraging. And as I said, right now in this time of uncertainty, that is what we need. And it's so nice to know that you're right there in our backyard and you're willing to help.
My pleasure. Thank you very much for having me.
Well, you heard the words of expertise from one of the top medical experts in Maryland. Coming up next, much more on COVID-19 and what can you do to prevent the spread. Stay with us. I'm now joined with Angela Rose. She is the president and CEO of the Harford County Chamber of Commerce. A lot of questions out there from the business community, and also how can we patronize some of these businesses to help them get back on their feet in this very difficult time. Angela is here to answer all those questions. Hi, Angela.
Hi, Kristy. Thank you so much for having me.
Thanks for being here. Now, Angela, tell us, what is the Chamber doing to help its members in this very difficult time?
So we are trying to really be a resource distribution center. We work every day. We have calls with the Department of Commerce, Department of Labor, the Office of Community and Economic Development. We're closely tied with the U.S. Chamber and the National Federation for Independent Businesses, Small Business Entrepreneurial Council, the Small Business Administration. So we're trying to compile all of those resources and weed through all of the information that they're sending out, consolidating it and pushing it out to our members. So for the questions that they have or the concerns that they have, that we're trying to keep them as informed as possible. We're also trying to be their voice at this point, and that's something that we at the chamber are very proud of, is being that voice of business and the business advocate, and letting our elected officials know, letting these groups know the trials and tribulations of what our members are experiencing right now. There have been a lot of questions with the stimulus packages and some of the loan applications and programs as what needs to be done. And then on the flip side of that, how do they navigate the now what's? Okay, we've received from some funding, but we haven't gotten any guidance on what we are allowed to utilize these funds for or not utilize these funds for. So we're really trying to be a conduit of communication and information to the different agencies, and make sure we're just answering as many questions as we can and being as helpful in our capacity as we can be.
Now, I know that obviously it's a struggle for everyone. So right now, we are only having essential businesses open. So talk to me about what is considered an essential business versus a non-essential business.
So with the stay-at-home order and that essential versus non-essential businesses, a lot of our businesses are having to kind of reinvent the wheel and work from home. So we have a lot of businesses that are able to stay open and work from home, work virtually. A lot of our members are restaurants, retail locations that have online ordering, so they can go ahead and do that. A lot of members who hadn't had that online presence before are getting involved in that and have had to evolve very quickly to stay viable and be able to still keep their doors open. So, we are seeing that from that essential side of the piece, but then we definitely are working with a lot of businesses who have had to halt operations. Their doors are closed because, just given their business model, they're not being able to be out in public, taking pictures or, performing their tasks. So it's a huge, diverse pool of businesses that we're dealing with, and different questions that we get, and kind of that assistance that we can provide.
Now, Angela, what do you say? I mean, obviously we're all struggling, but what are the biggest struggles that these businesses are facing right now, and what do you think that holds for the future?
The biggest struggle that I hear on a daily basis is what's happening. So it's been great that the government has been so responsive at the state and federal levels with trying to be supportive and offer funding and offer expanded unemployment insurance benefits, but it's the model of which it's been rolled out. So people whose funding hasn't been released to their bank accounts or haven't even gotten any follow-up. So it's the unknown. I think it's really that fear of the unknown, because they're not getting the information that they need in a responsive time, because a lot of the departments are overwhelmed.
Right. Yeah, there are a lot of unanswered questions, but I know that we can all do our part with helping. I can tell you, I've been doing my part. I've been doing a lot of takeout. So what can we as a community do to help these businesses get back on their feet?
You're absolutely on the right track. You are doing your part, and that's what we need. We need you to be shopping or supporting your favorite stores. If you are using professional services, please continue to do so. Do not halt what you're doing, but reach out and make sure you are supporting, and keep an eye on your businesses that you've partnered with or are supporting, to see when they do reopen that you can support them in whatever that way they may have. Or if it's been a retail store that never had an online presence before, check in, see if they do have an online presence now, so that you can support them.
Now, Angela, for all of our businesses and the patrons out there that want more information on, what businesses are open, when they're going to reopen, what we can do to help, or how we can purchase products, how do we find all that out?
So we have a directory, and you're welcome to use our directory at harfordchamber.org. On social media, we have an I'm Here Harford social media page on Facebook, and that really talks about business hours and that new business model. So you can check that out and see who's on there. And then again, I have to tip my hat from the restaurant industry. HarfordRestaurantWeek.com has been a great resource for keeping up with the restaurants that are open, what they're providing, if they're doing carry out, online ordering, delivery. That's a great resource as well.
Angela, thanks again. Always great to see you, even though I miss seeing you in person very terribly. That time is coming because, like we're all saying, we'll all get through this together.
Amen. Thank you so much for having me. I very much appreciate it.
Well, thank you again. And then coming up next, we're going to talk to a representative from Harford County Public Schools about the online learning and how we can help the students and the teachers get through it. Stay with us. I'm now with Susan Brown, who is the Executive Director of Curriculum and Instruction for Harford County Public Schools. As a parent, I know that I have a lot of questions about what the kids are doing for schoolwork online. We know there's questions for parents and teachers. Susan Brown is here to answer them all. Hi, Susan.
Hi, how are you doing, Kristy?
Great, thanks for having us. Susan, tell us, how are Harford County Public Schools adjusting to this new online learning curriculum?
It has been quite the whirlwind, to say the least, but we were pretty primed for the pump, so to speak. We have been working over the last several years of really realigning our curriculum in our learning platform, which is called It's Learning. And so our content supervisors and teacher teams have been writing curriculum in that platform for, I would say, about 6 years. So we knew that we needed to begin writing our curriculum that way, along with some professional development for teachers, and including them as part of the process because they're the professionals. So we have to make sure that it works for them in their classroom with their students.
Susan, what about the grading policy? How are students going to be graded throughout this time frame?
So we're using a pass, fail, and incomplete system for the fourth quarter. We had accomplished about 70% of our third quarter with the closure. And so with that, we were able to look at fourth quarter, close out third quarter with a letter grade as normal, and then did a pass, fail, and incomplete for our students moving forward.
Now, Susan, I have a 10-year-old and I have a 12-year-old, so we are adjusting to the online learning. Obviously, the parents have a lot of questions. So for the parents that are confused or maybe do have questions about how the online learning is working, is there a certain website they can go to, or how can they get more information on what they're doing right as opposed to what they're doing wrong?
That's an excellent question, and we certainly understand that everyone is in a new normal. We know that we have parents who are at home, they're teleworking as well. They may have multiple students within our system, just as you. So we've taken that into consideration. The first line of defense is the classroom teacher. So parents should work with them to really delve deeply into what we're expecting over the course of the week. We've created our lesson plans so that there's a certain number of hours that parents can expect from the teacher so that we're not overwhelming. And additionally, we've seen some very innovative ways that teachers have been working together in teams to reach out to parents. So we're still in the process of trying to reach everybody and making sure that they have what they need. We also created a parent resource packet that just was put on our website, and that is really speaks to mental health, sleep, and regular schedules during the day, as well as looking at the amount of screen time children are doing. So as we've created lessons and are working with our parents, we want to make sure that there is a nice balance between screen time and perhaps getting outside or having some downtime to be able to recharge, because I think we all need to make sure that we do that as well.
Well, Susan, there's a lot of questions out there. So can you touch on what are some of the most frequently asked questions that you're getting right now from parents and teachers?
Sure. One of the most frequently asked questions is we have learning packets for some students who don't have access or have limited access to technology and the internet. And one of the most frequently asked questions at the very beginning, when we had a quick turnaround, we had about 24 hours to get ready to send our students home with work. And that amount of work that went home, people asked, is this required? At the beginning, we really wanted to maintain skills, having students be engaged with reading and some math and having some recess, that type of learning and maintaining. Now that we've moved into teachers really taking over their instruction, the difference is, which do I need to do? Do I need to follow the teacher, or do I need to do the packet? And what if I have both? And ultimately, we want the teachers to be the professionals that they went to college to be. And so we want them to work with their parents and really have ownership, just as they would if we were in a building and teaching face-to-face, as we would expect them to do during the school year. So it's been very wonderful, really, in some ways, to see the innovation that's coming through from this closure.
Susan, thank you so much. I know as a parent, I had so many questions. A lot of parents and students, teachers, we all have questions, but Harford County Public Schools is doing such a great job. And I think all of our students, all of our teachers, all of our parents were all taken care of, and we owe that to you. Thank you very much.
Thank you, Kristy. It was a pleasure to be here today. And I really have to say it's a group effort. We are all in this together. We want the best for our students, absolutely. And we also want the best for our teachers. They're teaching and doing incredible things under amazing and unusual circumstances.
Absolutely. And as Susan just said, we're all in this together. Very trying times, but as a community, we are really coming together. And now we have a very special message for you from our county executive, Barry Glassman.
Hi, this is County Executive Barry Glassman. I'm coming to you from Bel Air, Maryland, and we are in the midst of a pandemic. As you all know, Harford County is responding to the COVID-19 pandemic that is going through the country and here in Harford County. First of all, I just have to thank all of our first responders, all the frontline healthcare workers that are working around the clock, in addition to my county employees who are acting as essential employees to keep county government moving forward. We're following the governor's directions, and I would just urge everyone to follow the social distancing. Currently, we are also wearing masks, and follow directions to make sure you continue to wash your hands and all the things that the health department is advising us to do. You can visit my county website, www.harfordcountymd.gov, really to follow weekly information on what to do, where to get help, all the resources you need here in Harford County and across the state. I would also urge you to stay informed and follow guidance from the CDC and our county health department, who's helping us from day to day. We're going to get through this together. Harford County has been blessed in the region. We don't have the most cases. We continue to watch certain areas of the county, and hopefully within the next few weeks, we'll be emerging on the other side of this pandemic. So I just urge you to stay calm, stay informed, and be safe, and stay Harford strong.
As you've all heard today, staying home is one of the most important things that we can do to combat the COVID-19 pandemic. We want to thank all of the workers, the essential workers who are on the front lines helping to take care of our community. You are the true heroes of Harford County. I'm Kristy Breslin. See you next month on Harford MagaScene.